Joining us is Dr. John LaPook, as always here. And John, a number of people have sent in questions to us on our Facebook page, and let's just go through them because they're smart. Chase Gregory asked, how are doctors preparing for this disease? Some of us live in small towns, and I don't see our doctors getting ready.
Yeah, well, people are gearing up all over the country. I know there have been directives sent out. I've gotten myself, since I'm a physician, directives from the CDC and from my local Department of Health. I can tell at NYU Langone Medical Center, where I'm a professor, they're actually having drills. They're sending in secret shoppers who are pretending to have symptoms of Ebola, and then they're pretending to be from West Africa to see, are they being asked the correct questions. Then in addition, they're having full-blown drills of people saying, this person doesn't have Ebola, but we're going to pretend they have Ebola. Come in and see, are all the protocols being followed?
Well, that sounds great, but when Thomas Duncan came to the hospital in Dallas, they sent him home, not suspecting for a moment that he had Ebola, even though he told the admitting nurse there that he'd been in Liberia.
Yeah, and Scott, we're seeing the difference between protocol and reality. And of course, I've seen this. I've been a doctor for 34 years. I've seen this all the time. I've seen patients, people I'm in training, fellows, interns, residents who are doing procedures and they're supposed to be wearing masks and they don't wear masks, and I have to just tell them to do that, even though the patient could have an infectious disease. Now we have something like Ebola, which pretty much no doctor has seen in the United States, and you have these protocols, and there's going to be a big difference between what the protocols say to do and what they're actually done. Now, in the case of Dallas, hopefully now there's been enough publicity, people aren't going to make that same mistake, although you never know. But I think that there are going to be new mistakes made, because I think statistically, Scott, we have to expect, in terms of what's the next case scenario, that there are going to be more and more people in West Africa who are going to get infected. People are going to come to the United States. There are going to be individual cases of Ebola, very important, individual cases, but that doesn't mean an outbreak. So Dr. Frieden has said with all the right controls, we can isolate it, stop it in its track. But what that's going to mean is that these emergency rooms, one case at a time, are going to see patients. And I suspect that they're not totally prepared because they haven't done this before.